Hey guys, this is Dr. Hines here with Ahead of the Curve Chiropractic. We have had a record-breaking week here in the office. We have been really busy preparing for the healthcare event of the year, the Own Your Health Revolution. If you haven't registered for that, that's happening October 26th in Plano, Texas. I'm really honored and privileged to have the opportunity to be a keynote speaker on this panel of amazing healthcare practitioners from Dallas. We've got chiropractors, we've got medical doctors, we've got an optometrist who's going to discuss the link between vision and brain health. So you do not want to miss it. You want to make sure that you get registered and reserve your seat. But I wanted to jump on because we've been so busy this week. I've had a lot of questions from you guys about disc bulges. So I wanted to talk about that today. So disc bulges, disc herniations, disc degeneration, degenerative joint disease, degenerative disc disease, spinal degeneration, spinal decay, osteoarthritis. All of those are terms that describe the same phenomenon that happens in the spine. And most of the time, it's preventable. So, there was a study done in 2014. It was published in the American Journal of Neuroradiology, and it actually compared 33 different studies of over 3,000 people and their MRIs. These 3,000 people did not have any pain. They were completely asymptomatic. And the MRIs showed that 37% of people in their 20s and 96% of people in their 80s had disc degeneration. So that can happen to you from either a trauma. The most common way to injure your low back is bending and twisting, often while lifting, and that's where most disc herniations happen, but also they can happen in the neck. So your spine should be perfectly straight from the front. From the side, you should have 3 curves. There should be a 45-degree curve here, 45 in your mid-back, and 45 in your low back. When everything's where it's supposed to be, then your ears are directly over your shoulders, directly over your hips, knees, and ankles, and all the gravitational stresses are distributed throughout the body evenly. Your spine is in a state of ease, and it's going to move the way that it was designed to. But what happens... Sorry, that was my dog, Sir Argyle Freckles Martinez. Come here, Argy. This is Argy, our unofficial therapy dog here in the office. You can follow him on Instagram at Sir Argyle. He's adorable. I'm going to put him down and let him keep playing. So what happens through traumas, we can cause disc bulges or just through poor posture and poor motion in the spine. So when your spine has the proper curves, then the disc spaces are bigger in the front than in the back. When we lose those curves, then I call this ice cream sandwiching. So the disc ice cream sandwiches or bulges herniates to the back and pinches those nerves, sometimes causing pain, not always, because pain is less than 10% of the nervous system. All of my patients should know that. So I don't send a lot of patients out for MRIs because I can see what I need to see in your x-rays. So a healthy neck curve looks like this. And what happens is through, like I said, traumas, through poor posture, we can lose those curvatures, and so the lower joints will carry more stress than the upper ones. This can happen in the neck or the low back. If a joint is carrying extra stress, it's not able to move the way that it should. If a joint's not moving the way that it should, it's not getting the joint nutrients that it needs. And if it's not getting the joint nutrients that it needs, it's going to rot, decay at an accelerated rate. And this is what we call osteoarthritis. That's where you lose calcium from the inside, it moves to the outside. A healthy spinal joint looks like this. Osteoarthritis, degenerative joint disease, degenerative disc disease looks like that. So you saw how that progresses and how that happens in the spine. So like I said, most of the time it's completely preventable, and it is reversible to an extent, but the longer you leave it there, the harder it is to correct it, and there are limitations to what you can correct. So most of us get our teeth checked on a regular basis by seeing the dentist and getting regular x-rays and cleanings. Most of us don't do that with our spines. But our spines are so important because they house our nervous systems. So in order for your brain to communicate with your body, you want to prevent degeneration. In order for you to be able to move and be active as long as you're alive, you want to prevent degeneration. So I hope that answers your questions. That's our focus and our passion at Ahead of the Curve Chiropractic is patient education and also the prevention of spinal decay. So feel free to message me if you have any questions. We'll be talking more about prevention at the upcoming workshop on the 26th. Again, that's Own Your Health Revolution. So look for that. I can't wait to see you there. I hope you have a great weekend.